Bismillah ar-Rahman ar-Rahim. With you, a student of a physical therapy at Hashemite University, we talk about transparency and medical ethics. A physiotherapist is a profession that carries all the sublime human meanings, which requires the therapist to act the amount responsibility required to treat people and save their bodies from pain and diseases. Our topic today is a small aspect of ethics in the medical profession, which is transparency. What is transparency? What is importance of telling the patient about his health? Also, we will learn about a method used in transparency and others through this video. We start with a simple and comprehensive concept of transparency as defined by the Institute of Medicine in a reliable, understandable way and information about quality and efficiency from the healthcare system and patient experience with the therapist, which may include price and quality data in order to improve the relationship and the clarity between two parties.
The relationship between therapist and patient is considered as a bridge that is crossing over toward healing or adaptation with the health state without any risk. The patient has the right to know his illnesses, and he must be fully aware of the treatment way from the beginning to the end. But also the duty of the therapist to find a suitable way and the appropriate time to tell the patient about his condition. He must make suitable atmosphere, deal with patient in readily, preface, concentration the age, the health and psychological state, and sharing results with patient. Also, he should be comfortable and controlled to his facial expression. Of course, in order to not frighten the patient or not make him worried. The therapist stress scares the patient and destabilizes his confidence. So, the therapist must be confident, clear his mind, and treat patient with care, even if the diagnosis was bad. In some conditions, the therapist can seek the help from the patient's family, that they give the patient introduction about his condition, and then the therapist gives the rest of details. Also, one of the transparency patterns with patients that when the therapist cannot treat the patient or maybe cannot diagnose his condition, he must tell him that and transfer him to another physical therapist to improve his physical performance.
Being honest with the patient and support him is one of the medical ethics that the therapist must do it in all cases. The physiotherapist must inform the patient about their condition and their healing progress, even if his condition or her condition it's become better and worse during exercise or didn't improve during exercise. So the patient trusts his or her physiotherapist. Of course, except some cases, it is preferred not to tell him or her about his health condition because it will affect in his physiological or physical state if we tell him about his condition. The physical therapist must tell the patient how much he has improved during the treatment exercise and not aspire to give him more exercise in order to get more money. The patient will think that he didn't improve during the treatment exercise and he will take more session and more exercise and more treatment and he will be hurt and harmed instead of benefit. So the patient will not get anything except wasting time and money. To avoid these risks or these problems, tell the truth from the start and don't forget you are dealing with people and you shouldn't play with people's life.
Therapists can hide the truth in the patient for a certain time or for certain limits, depending on their acceptance to hear it. The truth may make them worse, and we as a therapist have to take into account the physical condition and psychological condition at the same time. For example, children, they may not understand clearly their condition, so it's better to tell their parents about their condition. Patients with cardiovascular diseases, they can't bear such a bad news. Bad news may make them worried and stressful. Elderly people, they are very sensitive. They may refuse to continue their treatment. They may give up easily. Epilepsy and autism patients, they may have a panic attack, so we won't be able to control them.
A professional football player, 28 years old, during the match he was seriously injured in the knee. As a result, he suffers from a tear of the cruciate ligament. So, symptoms that appeared are swelling in the knee and hearing a sound like pop during the movement of the knee. These are symptoms of cruciate ligament. He was transferred to the physical therapy to start a full treatment plan cause his rejection of doing operation. First, we welcome the patient in a friendly and sweet way and talk to him about playing football and his wonderful talent. We must eye contact and great facial gesture to make patient comfortable and fearless. A player must be strengthened and told in a friendly manner, such as, I am about to tell you some kind of bad news. I am sorry, but your career and talent will affect in this injury. But with physical therapy and treatment and exercise, you will become better, inshallah. Always remember, the success is the jewel of ascension after stumbling.
Don't forget that our societies also contain therapists who are rude in terms of dealing with patients and use transparency in an incorrect way. As in the previous example, we present it an inappropriate way by the therapist with his patient. A professional playing player suffered his injury, which led to his treatment. So the therapist began to speak and shout loudly with the boredom. You must be careful while playing. Your injury is very difficult, and you will not be able to walk well or playing professionally as before, even after undergoing treatment. And if you walk for a long distance, you will lose your foot forever, and ultimately lead to the formation of a state of a bad feeling with the patient and lack of optimism for recovery, even if the injury is mild.
At the end, we have to say that the transparency increases the efficiency of work and working on to fight corruption in the healthcare institution and in the medical team who work together, as it increases the patient's confidence in himself and in the physical therapist who work with him. And the lack of transparency or credibility at work is a problem that may expose the physical therapist and the entire institution to legal accountability from the union or the Ministry of Health. As we mentioned earlier about the concept of transparency, it's basically a principle that contributes to creating an environment in which the information related to the patient it's understandable and completely clear. It's the key to providing a good care, as patients must be able to access the data related to their clinical results, like buying a new house or car. And the patient has the right of know his illness, and he must be fully aware of how the treatment plan will be proceed, but in appropriate manner with consideration the age of patients. He may be a child or elderly, the state of health,
like a patient with a cardiovascular disease and the patients with the psychological disorder in general.